Welcome back to Mayo Clinic Radio. I'm Dr. Sanj Kakar.
And I'm Tracy McRae.
It's picnic season and the time of year when reports of foodborne illnesses spike. According to the Centers for Disease Control and Prevention, 1 in 6 Americans get sick by consuming contaminated foods or beverages each year.
Salmonella infection, salmonellosis, is that right?
That's correct.
Okay, it's a common bacterial disease that affects the intestinal tract, causing nausea, vomiting, and diarrhea. Salmonella infection is usually caused by eating raw or undercooked meat, poultry, eggs, or egg products. Here to discuss food safety is Mayo Clinic infectious disease specialist, Dr. Nipunie Rajapakse. Welcome to the program, Dr. Rajapakse. It's nice to meet you.
Thanks for having me today. I'm excited to be here.
How common is salmonella?
So salmonella, up until this past year, used to be one of the most common causes of foodborne illness in the United States. This past year, for bacterial causes of foodborne illness, it was overtaken by Campylobacter, another type of bacteria, for the first time. But we do know each year in the United States, over 1 million people get sick from salmonella infection, and somewhere between 300 and 400 people will actually end up dying from it. So it is a serious condition and something that is relatively common.
And are there particular people at risk of getting salmonellosis?
Sure. So most otherwise healthy people, if they get a salmonella infection from something they eat or drink, will have what we call a self-limited illness. So as you mentioned, they may have some abdominal pain, vomiting, diarrhea, but usually this will go away on its own and doesn't usually need treatment in otherwise healthy people. However, there are certain people in the population who would be at higher risk of having a severe illness. We see this especially in young children or infants, in the elderly population, or people who have problems with their immune system. These can be people who are on medication that suppress their immune system, people with cancer or organ transplants.
So, Dr. Rajapakse, I wanted to ask you, as a child growing up, we would go to India very often, and it would be called Delhi Belly there, Tracy.
Oh, my.
And so how would one know if this is due to salmonella or, for example, like Campylobacter that you mentioned?
Sure. So there's a lot of overlap in the symptoms that people experience with foodborne illness. So based on the symptoms alone, it's really difficult to say exactly what the person has been infected with. It's also important to know that there's other non-infectious causes of things like abdominal pain and diarrhea that you need to keep in mind as well. So just from hearing what someone's symptoms are, it's impossible to know exactly what's causing it, though there are some exposures that we can look at, things that people may have eaten or had to drink that can point us in certain directions as to what they may be sick with.
Well, I'm just to clarify, a norovirus or something when it's people are not washing their hands, and then that is spread through a restaurant. If one of the workers has not washed their hands, is that also considered a foodborne illness, or is that just a different public health problem altogether?
Yeah, so there's, I think, over 250 different things that cause foodborne illnesses that we know about now.
Wow.
And so they can be caused by viruses, by bacteria, by parasites. So norovirus would be an example of a type of virus that can cause foodborne illness. There's also things in food that can also make people sick, things such as toxins or certain chemicals that are not infections, obviously, but can also make people sick from things they eat and drink.
So maybe, Dr. Rajapakse, you can set a score here with my wife. The other day, we went out and we had eggs, and they were soft-boiled, and I thought that was okay. Is that okay, or is there a risk of salmonella right there?
So the most common foods that we see associated with salmonella infection include meat, poultry, and eggs. And so any time that you're eating food that has not been heated to a high enough temperature to kill off the salmonella bacteria, you run the risk of getting infected with this if you ingest it. And so we do recommend cooking eggs all the way through until the yolk is hard to decrease your risk of foodborne illness.
So you're telling me there's millions of mothers out there who used to boil the eggs and you put soldiers in and dip the eggs for kids. I used to have that as a child, and our kids have that. Is that not a good thing to do?
So we definitely recommend any eggs that are being fed, especially to children who are at higher risk of salmonella infection, that they be cooked all the way through to decrease your risk of foodborne illness.
So this sounds like you were wrong and your wife was right. Is that what I'm hearing?
It's not the first time.
Okay.
I hope I'm not causing any
But you know
here.
what? I think he's right. Has the disease of salmonella or that has that I don't want to say improved over the years, but I think we used to eat a lot of eggs with runny yolks, and now hardly at all. Is it just because we know better, or is it because people really are getting more sick?
I think it may be a combination of both. We are lucky to live in a country that has very strict standards in terms of food production and has certain standards and regulations in place to help protect us from all of these things. But certainly because our food now comes from so many different places and in so many different ways, a lot of the times it needs to be transported over long distances. The risks are higher.
If you, going from the egg to the chicken, okay. If you have chicken that does have salmonella on it, if you cook it long enough, then that kills the salmonella and it's not as much of a risk, or it completely erases the risk.
So there's a few important things when you're preparing meat products. So cooking meat or heating it to a high enough temperature does significantly decrease your risk of getting an infection from eating it. For chicken, for example, we recommend cooking it to an internal temperature of more than 165 degrees Fahrenheit to make sure that you kill off any bacteria that may be present. But cooking alone is not enough. We have to be very mindful when we're preparing foods. It's getting into barbecue season, people are grilling outdoors, and we see cross-contamination of different food products as a big issue. So if your salad greens come into contact with the juices from your chicken, you're not going to be heating that salad, and so that salad then becomes a potentially contaminated food that can make people sick. So when you're preparing these foods, it's really important to pay close attention to keep your meat products very separate from your fruits, vegetables, salads. Make sure that you're washing your hands very well before you start preparing the food and in between preparing different types of food. And then lastly, making sure that you're serving and storing the food in a way that's safe. Generally, you want to avoid keeping foods out in what we call the danger zone. So between 40 degrees Fahrenheit and 140 degrees Fahrenheit is kind of the ideal temperature that bacteria like to replicate in. And so we recommend not leaving food out for any more than 2 hours between those temperatures. If the outdoor temperature is greater than 90 degrees Fahrenheit, we usually recommend cutting that back to an hour.
Okay, if you're going to be at a picnic, though, I have to have potato salad at my picnic. It's just a necessity.
Of course.
If I am putting it in a bowl of ice that I think is keeping it cold enough, how do you know if I'm going to assume that I need to just stick a thermometer in there? If you're going to do that to a chicken to make sure it's over 165 degrees, what temperature do I want to keep that potato salad at?
So generally you want to keep it as cool as possible. Anything below 40 degrees Fahrenheit is thought to be more safe than above that. And so the best way and really the only accurate way to determine the temperature is to use a thermometer.
I was just at a picnic this past weekend, and somebody said, "How's the potato salad?" And I said, "Cold."
Great.
We all agreed that was good.
So many people, for example, on the weekend go food shopping, and they'll put their food in their trunk and go off and do other errands. And so that food has been sitting in the trunk for several hours.
Oh, my gosh.
Is that a mistake that we've been doing?
Yes. So that is kind of the ideal temperature that bacteria love to grow and replicate on. So any meat that you've purchased that may be contaminated with bacteria, even if it were a small amount, that kind of creates an ideal incubator for the bacteria to grow and replicate. And if you then go on to ingest the food, especially if it's not cooked adequately, you could be putting yourself and your family at risk.
Well, so I've been doing that for a long time inadvertently.
Remind me that if I'm ever invited to your house to make sure that your wife is in charge of all of that. Any other food, keeping food safe at this time of year? Any tips that you want to share?
Sure. So I think some of the really important things are just making sure that you wash your fruits and vegetables really well. It doesn't reduce the risk to zero, but it's one of the best things that we can do, especially for products that you're not going to be cooking or heating. As I mentioned, kind of making sure that you keep meat and vegetable products apart and separated. Washing your hands is really the biggest thing. We know people that are infected with salmonella or a lot of these other types of foodborne illness. They can shed the bacteria in their stool for prolonged periods of time, even after their symptoms have resolved. And so proper hand hygiene, especially when you're preparing foods for yourself and for others, is also very important.
We've been talking about food safety with infectious disease specialist, Dr. Nipunie Rajapakse. Thank you so much for joining us.
Thanks for having me.
And that's our program for this week.